Samantha Jacobson. I'm going to be speaking about vaccinations. 35,000 cases of paralysis a year occurred from polio in the late 1940s. Parents were so frightened of the disease that they wouldn't allow their children to even go outside and play. Travel and commerce between cities was actually put to a stop and restricted due to the spread of polio. Many public health officials imposed quarantines on homes and on entire towns where there had been diagnosed cases of polio. In 1954, Jonas Salk began testing his inactivated vaccine for polio in a placebo-controlled clinical trial, meaning that he gathered a bunch of people and he gave some people the vaccination and other people a shot with sugar water in it so that they would not know which they received, so they could see how the vaccination actually affected the people. In this trial, it enrolled 1.6 million children through Canada, Finland, and the United States. In April of 1995, Salk's vaccination was actually adopted by the United States. Fewer than 100 cases of polio were found in the 1960s. And by the 1970s, there were only 10 cases of polio recorded. Since 1979, there have been no polio cases in the United States. Through the use of vaccinations, we can prevent diseases and illnesses in ourselves and our children. Immunization can save your life. You can be protected against more diseases now than ever before. You can be protected from polio, tetanus, influenza, hepatitis A, hepatitis B, measles, mumps, rubella, and many more. Some of these are actually in one vaccination together. Measles, mumps, and rubella can all be prevented through one vaccination. By getting vaccinated, you can save your time. So there are a lot of schools and other healthcare and child care facilities that will not allow your child to attend if they have not gotten their vaccinations. So if you go ahead and vaccinate your children now, there's going to be less room for error and time when you take your children to those places. By getting vaccinated, it will also save you money. Vaccinations are usually covered by insurance, and there are also programs for low-income families to get free or reduced price vaccinations. By being vaccinated, you reduce the amount of days you miss of work by a preventable disease, and some vaccination preventable diseases can actually result in prolonged disabilities, which therefore result in a financial toll. Being vaccinated can save your life and the lives of those around you. By being vaccinated, we impose something called herd immunity. People who cannot get vaccinated, such as infants, because they're too young to receive the vaccination, or they're unable to receive the vaccination because they have an allergy, or a weakened immune system due to something such as cancer or such as leukemia, they are prevented because there's no disease in the area they're in, so therefore they cannot catch it. The elderly also has a weakened immune system, so by being vaccinated, our elderly are actually protected through herd immunity. We also have many others in our community that are not infants or elderly that are immunocompromised. You can be immunocompromised for things such as HIV and AIDS, cancer, going through radioactive treatment, or type 1 diabetes. Type 1 diabetes is very common in today's day and age, so there are a lot of people who suffer from this and are no longer able to be vaccinated due to that. Vaccines are very safe. Vaccinations are very well studied before they are administered. Vaccinations are developed in the lab and must show some sort of potential before they can move on. Once it shows the potential that it could help the community, the vaccine is then tested on animals. If it is found that the vaccination is safe for animals, it will be moved into a clinical trial. The clinical trial only uses volunteers. In the first phase of the clinical trial, they will focus on safety, and only 2 to 100 healthy individuals will be given the vaccination. If it passes that safety phase, it will move on to phase 2, where several hundred volunteers will participate, and they'll do studies on the short-term effects of the vaccination. If there are not any severe short-term effects, the vaccination moves on to phase 3 of the clinical trial, which involves hundreds or thousands of volunteers, and then it compares the vaccination with those who have received a placebo. Then, if it passes all 3 phases of the clinical trial, we go into the VAERS, which is a system, the Vaccine Adverse Event Reporting System, which collects and reports any adverse events after vaccination. Then we go to the VSD, the Vaccine Safety Data Link. which studies and determined which side effects were reported were actually due to the vaccination. If there have been no severe adverse events due to the vaccination manufacturing is then regulated and put under strict restrictions and tested to make sure they are pure, safe, and potent before they are administered. Serious side effects, such as an allergic reaction to a vaccination, are very, very rare. There are common local reactions such as redness, pain, swelling, tenderness. There are also systematic, which tend to be fever, irritability, drowsiness, or a rash. There is a 1 in a million chance of actually having a serious reaction to a vaccination. Many people express concerns about autism due to vaccinations. There has been no proven link between autism and vaccinations. Researchers show that thimerosal does not cause autism spectrum disorder. Thimerosal is found in very few childhood vaccines. The only vaccination which still contains thimerosal are multi-dose vials of the flu vaccination. So if you get a single dose of the flu vaccination, then you will not be exposed to any thimerosal. The idea of autism coming from vaccinations is due to a man called Dr. Wakefield. There was no data that supported an association between the MMR vaccination and autism, such as he claimed, and he also had no plausible biological mechanism. His findings were published in the Lancet paper and since then has been retracted. Wakefield was also stripped of his license to practice medicine. It was found that he had pushed through this data to try and get a bigger name. He had no real scientific findings and it scared people into not vaccinating their children. The chance of contracting a preventable disease far outweighs the chance of suffering from the side effects of vaccination. There are no valid studies linking vaccinations to autism. Vaccinations are very well studied and very safe. Vaccines protect you from preventable diseases, and vaccinations can help prevent those around you from contracting preventable diseases. Thank you.